Good afternoon. Thank you guys so much for joining us today to our first Family Advisory Council meeting for 2023. Just a few housekeeping items. We are going to ask that everybody is muted during this meeting when you're not speaking, so that the speaker has an opportunity to share and everybody can hear. We also encourage you to use your video. Today's session will be recorded for viewing at a later time. So with that, we will go ahead and get started. Today we'll be speaking about the waiver redesign. We'll be talking about budget updates. We have some updates through the family engagement. We'll have some time with Director Hauk and time to discuss some questions. What I didn't include on this waiver redesign is that we'll also be discussing some Medicaid updates as well. So with that, we will go ahead and get started with Nyoka Kradoff.
Hello, everyone. I just wanted a couple of brief updates in case some of you were not aware. There were some date changes with the Appendix K flexibilities. So the first bullet point here does talk about President Biden did recently announce that the federal public health emergency will end on May 11th. And then with Appendix K, those flexibilities then do not expire until November of 2023. That's the 6-month unwinding period then with Appendix K. So DODD has started working with Ohio Department of Medicaid and the other agencies to really start, now that we have some dates, working on what flexibilities will be kept permanent and how that process will look. And so all feedback, we've been receiving lots of feedback throughout the entire pandemic. So that is all being considered and looked at. We've been consulting with several agencies, along with Ohio Department of Medicaid and with CMS to really have these conversations. So there's really two primary flexibilities that most families have really voiced support of, and that is home care and shared living on the same day, and also parents of minor children being paid caregivers. And so we are very much aware of the support that provides to families. So there's more to come on that in the coming weeks. Since this slide was made, I let Meredith know and sent her the handout. I'm thinking many of you have received the communication, but Ohio Department of Medicaid did issue a communication also regarding this information and the fact that there will be some webinars upcoming. Those are tentatively scheduled for next week. As soon as they are finalized, they should be finalized any day now. That will be communicated out to families as well. So I did send that memo to Meredith, and she will be getting that out to everyone for anyone who hasn't seen it. And then we will also get the webinar information once that's finalized out to everyone as well, so that you can participate in those webinars. So I wanted to share that information with everyone.
Thank you so much, Nyoka. And I will open it up for a little time for questions if you're available, Nyoka. I know you have to run.
I am available, and certainly I'm also available for questions anyone has even after this. You're always welcome to email me.
If you have, I don't have a question, but I would just like to once again throw my hat in the ring here of saying, if you are going to continue the parent support pay, please include the self-waiver parents. So many of us were approved. I did all the training, had everything set up to go. And then after a late Friday night decision was booted off of that, have had, no help through any of this. It's just not right because of language on paper to keep excluding the self-waiver families from the parent pay.
We do understand that, and the self-directed services are included in our conversation. So let me assure you of that.
Thank you very much.
You're welcome.
Do we have any other questions?
Just a quick question. When the notification comes out with dates and registration links for those Zoom conversations, should we be looking for them to come from you, Meredith?
Nyoka.
Mm-hmm. I'm not sure that you have to register for them. I'm not exactly sure how they're going to come out. I don't think they'll come from Meredith. Meredith may send you a communication about them. So yes, we'll get you that information. And when she sends you the communication, it will probably tell you how to connect with the webinar.
Okay, thanks.
You're welcome.
Excuse me, I have a comment. My son gets shared living. I'm his mom, and he requires 24-hour supervision and 24-hour support. So when Appendix K and all this information came out, I did not hear this from my support administrator. And so I actually had to approach her. I was hearing it from other parents. I was hearing it from information that I was getting from DOD. And so my question is, how do we as parents even know about what Appendix K can offer us as far as with shared living and getting that additional support if we're not hearing it from our support administrators?
So, when Appendix K ends and this becomes a permanent, whatever is decided to be the permanent service, DODD will have many communication, methods to get that information out. So I don't know if you receive newsletters and things from the department. If not, I definitely recommend that you, enlist in those. These councils are a great way for you to get that information. So certainly your county and your SSA should be aware as well. But I think it's always a good idea to be as connected to the information directly as you can. And we will definitely make, anytime we start a new service or engage in something, we certainly try to have an educational component about that.
Yes, and I do get the information from DOD. I do sign up for that, and that's how I was able to find out about it. It's just a little bit concerning when your support administrator is the person you're working directly with, and they know your needs, your immediate needs. And
Sure.
we as parents, we can't say yes to things if we don't even know if it's available to say yes to. So I actually approached her, and then she went to get some more information. And so now I'm actually able to utilize that because, again, my son requires one-to-one 24-hour supervision, which is very, very taxing without being able to get that break or get someone else to take him for a few hours. And then even if he's taken for a few hours, I didn't even know I was able to bill for that. So
Sure.
I'm just, it's just a little bit concerning because all the parents do not actually get all this information from DOD. And if the support administrator is the person that you're looking to find out what's available and you're looking to for support and help, it's just a little bit concerning. So I just wondered. Okay.
Yeah.
Thank you so much.
I understand.
For that information.
I understand. Yeah.
Mm-hmm.
Thank you so much for sharing that. If we don't have any other questions
I'm sorry.
Go ahead.
I'm sorry, Meredith. I have one question. This is Kate from Northwest Ohio. My question is, Nayoka, will there be training for SAS and support and all of those things, not just for parents, but also for SAS's boards of DD, so that if we are going to change the rules, that there's not that adversarialness of, no, we're not doing that, and you have to use natural supports, and these are your natural supports, and all of the frustrating messaging that I think some parents received in the middle of Appendix K.
Sure. Yes. Again, each time we roll out a new service or make changes, we do our very best to get training out. It's always available. We can never guarantee 100% of people take that training. I think the challenge, and I'm not making excuses during Appendix K, is that we were in the midst of a pandemic. And so I think it was more difficult to get that training and everything that was happening out there. But certainly with the permanent changes, we will absolutely have training for SSAs and county boards. Yes.
Thank you so much. Thank you, Nayoka, for your
Okay.
time
Certainly.
today. And I will be sharing to all of the folks who are registered and attending this meeting today the handouts that Nayoka has shared, and also Nayoka's email information, so you can contact her directly in regards to these changes. Thank you so much. We're going to move right along to our next topic, which is waiver redesign. We have Janet Steffen here from our Medicaid Development and Administration Department to share about that work.
Hi, everyone. I don't have a ton of information to share with you, but I know last time this group got together, I believe Director Hauk introduced the project to this group. So I wanted to let you know where we're at this point. So we hired Deloitte to assist us with this work, and we began the project, I think second week of January. And what has transpired so far is a lot of information gathering. So getting Deloitte up to speed about the Ohio system that existed leading up to where we are now. So as you can imagine, that's taken a fair amount of time to kind of get them up to speed. And because the project is relatively comprehensive, there's been a lot of work and discussion to make sure that the Deloitte team understands what we do so we can work together to, take the next step. So again, a lot of the work so far has been collecting data, again, hearing about our current funding system, as they prepare to assist us with doing a national scan in some instances and engaging stakeholders along in the process. So to let you know, you should be seeing information coming out on our website relatively soon in regards to this project. And we intend to keep people updated through DoDD tools such as the memos, our website, in addition to direct engagement with stakeholder groups. So that will be a very robust process and will most likely look and feel a little different than it has in the past. By that, I mean, we'll be utilizing tools other than just a standing work group, for example, to kind of get at information. So Deloitte is finalizing their stakeholder engagement plan for us in the leadership team to review and approve. And I'm really happy with the direction that's going, again, because it is encompassing all stakeholders in the system and engaging them in a variety of ways. So, like I said, unfortunately, I don't have a lot of details for you today, but just letting you know that's where the work has started and that's where we are now. And there will be lots more to come.
Thank you so much, Janet, for sharing information. And I want to, open the floor for families and folks who are joining us today. Do you have any questions for Janet?
And I'll also add when we are live and things are up and rolling, there will be a shared inbox between the department and Deloitte. So as communication comes out, as folks are engaged, that can be another tool to ask questions specific to the project, as well as getting in touch with me, of course, too, if you have questions as we move along.
Hi, this is Kate again. So as we're looking at waiver redesign, are we also looking at kind of opening up and having transparency with the algorithm for like the needs assessment and those kinds of things?
So, yeah, so part of the project is, of course, looking at our assessment tools, and I'm assuming you're referring to the DDP, as well as rate models as well. So yes, all of that is part of this project.
Thank you so much. Do we have any other questions for Janet at this time? Janet, I will go ahead and share your information as well, so folks can reach out as questions come about. I know when you leave a meeting, sometimes you come up with those questions later. So thank you so much for being with us and
I
sharing.
actually have a
Oh.
quick question.
Oh
Sorry.
yeah.
My name's Tina. I was just, you're talking about the waivers. Does that include like the IO waivers?
Yes. Yes.
Okay, now if they're on an IO waiver, does that mean that the waiver is for their individual needs? Like it should meet their individual needs, correct?
I can, yes, explain more what you're asking.
Okay, so my situation is doctor recommended they stay home because they were getting sick continuously every time they would go to day programming. Well, the SSA says their waiver will not cover for them to stay home. Granted, they're 44 years old. They've had melanoma and cancer. They're, she's in a wheelchair. She's got, a lot of medical issues. So I just wondered if it's and she's on an IO waiver, why the IO waiver won't cover her to stay home.
Right. Well, so that is hopefully one of the issues that this project will tackle. And again, I'm assuming it's because how budgets are established, meaning a budget for day services and a budget for other services. So that is one of the primary goals of this project, is to look at how we can better manage those budgets to meet needs versus perhaps what you're experiencing now, which is a limitation in a day budget versus the rest of your budget.
But I think even now you have some options. So this is Nyoka speaking again. If you would like to reach out to, once Meredith sends the email, reach out to me. I can connect you with somebody from our technical assistance area, and we can talk more about your specifics and see if there's something that can be done.
Okay, thank you. That would be great.
You're welcome.
Thank you so much, Nyoka. And yes, I just want to share as questions come up, if you have individual or very specific items, feel free to reach out to me or the other folks on the leadership team here at DODD, and we'll be happy to address those questions. Is there do we have any other questions regarding the waiver redesign? Okay, thank you so much. So our next item on the agenda is budget updates. And Janet, thank you so much for your time. Thank you again for all of the information. So I will hand it over now to Jeremiah, our Deputy Director and of External Relations, excuse me, so that we can discuss some of the updates that we've had in our budget. Thank you so much for your time, Jeremiah.
Thanks, Meredith. Thanks, everyone. So I just want to run through kind of where we're at. So budget status, Director Howe testified yesterday in the House Subcommittee on Health and Human Services. So we'll post a link to that here shortly, but we did start a budget page on our website. And so if you want to follow along there when we issue communications around the budget, or when the legislator, the department or the administration puts out communications, we'll post those there. So you can see the director's first testimony in front of the full finance there and some of our communications that we put out thus far. So again, she did testify yesterday, as did a lot of our stakeholders. So a lot of the associations and some providers had testimony yesterday. There's also testimony today and public testimony tomorrow. And we believe that the subcommittee will have testimony 3 more days next week, and so we can post those on the website as well. But if you are interested in testifying, I would say the best way to get a hold of that is on our website. There are links for the committees that are seeing the budget bills, and you can sign up for emails from those committees. And so those committees will send out notices. They'll show you when you can testify, where you need to send your testimony. And so if that's of interest to you, please use those links. But if you have questions, you can certainly keep in touch with me. So we know there'll be public testimony again through next week. And if you want to go to the next slide, Meredith. So that's where we're in the process. The House is doing some work, and then that'll repeat and go into the Senate. So I just want to touch on, hopefully you were able to see, and if not, there's a recording and it's on the posted website that I talked about. We did a budget webinar that was a lot more in depth on what is in the budget. And so Director Houck, myself, and Steve Beha on the team provided an overview. And again, the director did that for the public and the legislator yesterday. So if you want all the details, please check out those videos. But our budget is really centered around 4 priorities. And the first certainly being the most priority of the priorities, which is the DSP workforce, and increasing the rates that pay their wages. And so we're really excited and encouraged that the as introduced budget increases those rates to an average of $16 an hour. And so right now we're close to 14. So over a $2 an hour increase. And if you remember, just a few years ago when the governor took office, we were at $11. And so, we're getting to a $5 increase over this administration, which is really exciting. But we also know for families, providers, DSPs, that we just had a lot of catch up to do. That rates hadn't been touched in a while. That $11 was really lagging, and where we're at now, upper 13 is still really lagging. So this budget invests hundreds of millions of dollars just to get to $16 an hour. And we're really excited about that. That's the largest increase that we've seen in our system. The next priority, and I should mention, I'm sorry, and Meredith, can you go to the next slide real quick? I want to make sure that I'm going to cover. Okay, yep, if you want to go back, I'm sorry. So we talk about wages a lot. We talk about rates a lot. It's the number one issue. So I end up just going off on a tangent about rates. We know it's just critical for everyone. So second up is some efforts to increase advocacy and accessibility in communities. Next is around our technology supports and being a technology first state. And then last is our efforts around youth with complex needs. So I'll just briefly go through each of those 4. So on the next slide, which I already touched on, is the rates. And I did want to point out, and again, you'll have this slide deck, and I believe it's posted on the website as well, shows all the rates that are being adjusted, which is really all of our key rates. It's comprehensive, that across the board, we tried to get to an average of $16 an hour. Some rates that don't pay for a person, but really the support, like home delivered meals, or rates that are more professional, so waiver nursing, those were brought up to rates comparable to other agencies. And so you can see that list there, and those are all increased again to get to that $16 an hour or comparable. And all of those are the largest increase that we've seen through our budgets. Next, I just wanted to talk about the ICF program briefly. So our ICF program is the same, where it is receiving increases to get their DSPs to an average of $16 an hour, as well as they have a cost-based formula, and so this budget supports that increase. As well as there are a few ICFs who really cater and support people who are dependent on ventilators for their care. And we have not been able to adjust that add-on rate for those individuals in the past. And so that budget does this really with the goal of those who are medically complex and on ventilators, that there are capacities at the ICFs to serve them. And then last on the wage and the DSP component is we have some initiatives to support DSPs in other ways. So we know that wages are the most critical aspect to address, but we know that there are other ways that we can support DSPs. So we do have some funding in the budget for things like centralizing a portal where DSPs could track training, track certifications. They could take that with them. Also leveraging technology and applications so DSPs could have on-demand access to other professionals, training, other resources. And so excited about that. So on the next slide, Meredith, go through our advocacy and accessibility. The first item is county board representation. So we have budget language that would require that every county board of DD in the state of Ohio have at least one person on the board who is eligible for services. So currently, the commissioners who appoint 5 members of the board, there are 2 slots that have to be either a family member or a person eligible for services. And most often we see that that is made up of 2 family members. And so we're addressing that by leaving those 2 the same. So the commissioners can appoint either a family member or a person with disability for those 2 slots. The other 3 slots that the commissioners have are pretty open on what they can appoint, and we're going to require one of those 3 that are more broad that has to be a person who is eligible for services. So that doesn't limit a county board for having more than one person eligible, but it does create that requirement that every board will have that. And then additionally, not budget language or an initiative, but around this, Nate, who's on the call, Nate Turner, is working already now with our internal team, with county boards and advocates to make sure that we're supporting people who are interested in doing this. The next is universal changing tables or adult changing tables. So we've worked with a group of moms that lead a group called Changing Spaces, who have advocated in their communities and at the state level for the installation of adult changing tables in public spaces and businesses. And so we're leveraging funds in this budget to create a grant program that would allow places to apply to us for funding to install those tables in their businesses. So excited about that and increasing the number of public places and businesses that families can attend. And then last, our Adult Protective Services, or APSI, they are receiving an increase in this budget so they can address some of their waiting list and make sure that people who need guardianship services have that available to them. On the next slide, technology, I believe. Yep. So in the previous budget, the governor dedicated some one-time funds to the department to help us leverage technology and promote it better. And we're excited in this budget that we'll have a dedicated line item for technology. And so before it was just part of one line item and it was just in one year of the budget. Now we'll have established ongoing funding that will allow us to support technology initiatives. And so we'll do that in the budget. So you'll see a continuation of things like the tech ambassadors, grants to support providers who want to become tech providers themselves, as well as a new initiative around regional hubs. And so we want to look at providing more opportunities for people and families to go see technology, go try technology, and see how it can work for them. And then lastly, on the next slide is multi-system youth or youth with complex needs. And so in this budget, we have a dedicated line item as well for multi-system youth, and there's an increase in the budget for that line item. And so that'll allow us to continue programs, continue our keeping families together program with our county boards, where we're funding local efforts to keep families together. And then it'll allow us to expand our residential options. So currently we have a limited number of ICF beds for short-term residential stays for multi-system youth. In this budget, we'll be able to partner to expand that. And we do know that there are some instances where a long-term residential option is going to be needed for youth. And so we're going to work with ICFs around a funding mechanism for that. So that's all I have, very quick. Again, there's a lot more on the website, and I can make sure that Meredith has that link, and happy to answer questions right now or at any point. Thanks.
Was a lot of great information, Jeremiah. Thank you so much for your time and for sharing. I want to open to the folks if there's any questions that you have right now. Thank you guys so much. Jeremiah, that was a lot of information, so thank you. And I will be sharing all of the links and Jeremiah's contact information as well. We're going to sidestep from our agenda for a moment here, and I am going to stop sharing my screen, and I'm going to allow Corey Ferguson, our statewide Life Course Nexus manager, and to share his screen so that we can have an opportunity to discuss the Ohio ISP with Beth Chambers.
Hi, everyone. Just wanted to give some quick updates about the Ohio ISP. There's my contact information, and wanted to share how many plans are now in the system. They're over 3,000, so that's huge progress. And then the total number of plans that's in Salesforce, the DoDD system, and 1,738 of those are from the third-party vendors. So you can either enter directly into Salesforce, or there are third-party vendors where captures the same standardized information and then transmits into our system. So it will all be housed in Salesforce. There have been a lot of questions about who can access that. Everyone will be have access to Salesforce. So if the county you're working in, if the plans are in Britco or Primary Solutions, the third-party vendors, you can access it there, or you can always come to Salesforce. So we have tons of information on that. I don't want to overcomplicate it, but just wanted you to know that there are lots of plans in the system. Obviously, statewide, we are working on getting communication out and timing of things. We want to hear from people when they're experiencing kind of the transition to Ohio ISP. So we want to hear from you. You'll look forward to some communication about how you can complete surveys about your experience, what's working, what's not working. We will give some links to surveys and give you updated information. We really want that to happen once your team starts experimenting and using the Ohio ISP. So we've had a lot of conversations to date about the template. Now, as people start entering plans into the online system, experiencing the conversation, what kind of support you're getting, we will want to continue to hear from you. So stay tuned. We'll be having information out soon. There's resources. There's our website information. There's also the email address listed below, and that is checked twice a day. And the regional support facilitators, there are 6 regional support facilitators who are supporting SSAs and QIDPs around the state. and monitoring the email daily for questions about Ohio ISP. And we want to remind you, it's not just about the template or the online experience. It's about any communications, any questions you have about what to expect. We have frequently asked questions posted on our website, lots of information, lots of resources. And as I said, we have a whole team of people that can help navigate through that process if you have any questions.
Thank you so much, Beth. I do have one question because we might have some folks on with us today that are new to Family Advisory Council or new to the DD system. Would you mind sharing just briefly what the Ohio ISP is?
Yes, thank you, Meredith. The Ohio ISP, it's a standardized assessment and template, assessment and planning template, and it's more about the process. So it's kind of a culture shift. We had lots and lots of different ways of doing assessments and plan throughout the state, 88 county boards, over 500 ICF members. And so it's a way to standardize the process so that people can easily transfer from county to county to from an ICF out into the community. It's a way to make sure people understand what's important to an individual and what's important for that person. So it's a way to standardize the questions, to focus on communication and build on a person's strengths and needs.
Thank you so much. So I want to open up the floor for questions for Beth. Does anybody have questions? Okay. Oh, I see somebody unmuted.
Hi, my name is Karen. I just have a question regarding the Ohio ISP. How soon can we see that in the system? So, for example, my son just had his review a couple weeks ago, and I don't know what the time frame is as far as all the approvals that's needed, so that I'll be able to see that in the Ohio ISP system. Do you know how the process works?
Yes, it depends. Counties may start earlier than others. Some might hold the meeting a little bit earlier. So there's a planning process and period. I think the best piece of advice I can give you is talk to your service and support administrator to navigate that, to see when you should expect that. They should be able to walk you through that process. And if you need any assistance in accessing the system, please feel free to use my contact information. I'll direct you to the right person or walk you through that. So typically after the approvals, it's pretty quick. So that should be a pretty quick turnaround. But I think your service and support administrator would have a really good idea of when we could help you navigate that.
Okay, thank you.
Thank you.
Hi, this is Jennifer. I don't even know what you're talking about. There's a system where we should be able to see our ISP plans. Like, we just redid ours in December. I've never even heard of a system that we could log in and we see. I just get it's a phone meeting and then I get a packet of paper mailed to me.
Okay. That people, as I mentioned, timing, I could clarify. A lot of places are using the Ohio ISP template. We call it the Word document, or it's a Word version. So they might not have entered the plan in the system. So again, local entities are at different places with this. So we've encouraged people to start engaging in the conversations to utilize the assessment and planning template, but they may not have entered it into the system. So that's where we have a really good gauge of where each county is or each facility. So if you talk to your services and support administrator, they can let you know whether you're going to receive just the paper copy like you always have. That part of the process might be the same as it has been in the past, or if it's transmitted or entered into our system to date, you'll have access to that. So they should be able to guide you through that. If they have not yet begun transmitting those plans, then your process might not look much different than it has in the past. They would have used the new template and the new process, but it would not change how you're viewing the plan, if that makes sense.
Okay, so should I just go to the DODD website and there's going to be a link for Salesforce? Like, I don't even know like where you're saying to go log it. We know nothing about this in Greene County. I have another friend on the call too who's messaging me. We have never heard of this.
Okay. So it does depend on where the county is. So we can get you information about that. We will make sure that we touch base with Greene County to make sure that you see where they are to get you the most accurate information. I can, there's information posted on the website. If you give me your contact information, I can certainly follow up and walk you through kind of where your county is, and we can touch base on that.
Okay, thank you. And I actually just emailed Meredith.
Okay.
So I don't know if she could forward. I don't know how to get a hold of you.
That's fine. Shit. Meredith will pass it along, I'm sure. Thank you.
Thank you so much.
Absolutely.
We'll get you all the information you need.
Thank you.
Yeah. Thank you, Beth. I see Amy has her hand up. Amy Davis.
Yeah, I'm my son's independent provider and guardian, which I, went through the courts, and it was kind of a rough process. I had to pretty much work with the SSA, and basically I pestered them and got on your website, which was very helpful. I'm on actually 1.2 of the new Ohio ISP, and the SSAs at Stark DD. I'm at my SSA. He's like, I have like 20 questions already written up, so he's like, ready to ask questions. But my question is they told us we'll be getting an outcome document eventually from it for our, what supports we provide. Well, as a parent, you provide pretty much everything. But when is that part of it? Is that going to take a while before that comes out?
It should not. You should be getting that as the plan is finalized after the approvals. You should be getting that outcome document to show what you're responsible.
I got the for the outcome. I meant like your support. I have the output one, which they just showed me. They showed me how it's going to be set up, kinda, but I think they're trying to break it apart to make it a little bit smaller, because they kind of group it all together of what you do. And especially for parents, I think they're trying to make it easier for parents, because right now we're doing the majority of the, it's hard, like there's no providers right now. And
Okay.
so like they said that like right now I make my own sheets and make my own documentation sheets, on like, because basically my son's 19, but he's like full assist, still not, he's still in diapers and stuff like that. So, like I have to mark everything down that I provide for him, but they group it all together, but they want them to start separating it out. And so there's more, they don't like when you, I guess they said there should be a sheet that like it does the documentation for us, and it should come out within that ISP. Is that correct?
Yes, that part should be coming soon, but your county board should be working with you when you get that planned. You should have that broken out. They might need to clarify that with you.
Yeah, we are. We're trying to work
Okay.
it out right now. It's a process, and there's a lot of things that they notice that they can't. They're like, why am I putting it here and not here? Because they're transferring over. So
Right.
I'm sure you're getting a lot of questions from them. Like I said, I know mine, he writes as he goes, because they have a lot of questions. So it is a
Right.
learning. I mean, it actually is nice. I mean, I think it's a lot more easier than the old one.
Well, good. And they will continue to refine that. And the documentation sheets are a huge focus right now. It's, we are working with counties who are trying to separate out that service and support, where things, as you mentioned, kind of get lumped together, trying to pull that out, having that conversation so that each responsible party knows what it is that they're going to be responsible for documenting.
Okay. Thank you.
Thank you.
Thank you so much, Amy, and I will get you connected to Beth for further questions and information. I appreciate everybody's questions, and I do want to move on because we have a few more things to cover. So thank you so much, Beth, again, for all the
Thank you.
information. Sure. I'm going to go ahead and attempt to reshare my screen for our next updates. Thank you guys for your patience with my limited technology here. um, so I wanted to give a little bit of some updates in regards to a point that Jeremiah Wagner had spoken about earlier. And I'm going to introduce you to my colleague, Nathan Turner, who is our policy advocacy specialist. Nathan?
Hi, everybody. Good afternoon. Thanks for having me, Meredith, and giving me the chance to speak to you all and introduce myself. For those of you that don't know, I joined DODD on November 7th, and I am the advocacy policy specialist. And most of my time right now is, as Meredith said, supporting budget outreach, particularly around the language that would require county boards to have one person eligible for supports on county boards, each of the 88 county boards of developmental disabilities. And this is critically important because it's necessary to amplify the voices of people with DD supported in the system. And it's really a perspective that we historically haven't had. The law as it stands currently with the county commissioners essentially stipulates that two people must either be eligible for services or be a family member, but the vast majority of these appointments have almost always gone to family members. If you think about well over 600 county board slots, the best I can determine is that maybe about 33 of those since the inception of county boards in 1967 have been people with lived experience in the system. And so I've been doing a lot of work to identify and recruit people who might be interested in serving on county boards and support the county boards and the people living with disabilities that are interested in serving on county boards to be the best board members that they can be. And I also think it's a great opportunity for folks to build some skills and hopefully lead toward competitive employment outcomes. I'm in the process of working with several county boards to help them develop internal and external outreach strategies and just kind of think about how they might recruit people who are interested. A lot of the county boards have, departments for community integration, and within those, there are organizations for the people who receive support to come together and share experiences. And in a lot of cases, those are great ways to talk about what it means to be on the county board and what the county board does. And it's also important in the same way to talk about other opportunities outside of the DD system to serve on maybe a volunteer nonprofit, maybe things like the Rotary. A lot of the centers for independent living need people with disabilities to volunteer at them in various capacities. So it isn't just county boards or DD council. There's a wide array of opportunities, and supporting all of those, I think, is an essential component of this strategy. But county boards, in particular, are unique because of the way that county boards actually do their business. In that, sometimes there may not be a lot of discussion at the meeting. There might be, discussion in executive session or working with various staff members. So in line with that, I'm also thinking about various tools for governance to help support new board members and just kind of understanding that nuance. Is there any questions in the meantime? I know I talked about a lot of information quickly.
Thank you so much, Nate. You have a great perspective and your work is so important. So I appreciate it. And it's an honor to work beside you. Thank you.
Yeah, it's
I
certainly
don't
my
have a
hope that,
question.
sorry.
Go ahead, go, no, go ahead.
No, I just wanted to add that it's certainly my hope to be a bit more visible with the outreach in the months ahead. And we're talking about different ways to communicate as a means to drive the recruitment, because one of the asks that I get, is we want to find candidates that are really interested in the process and ideally more than one. So I'm really just thinking about unique and innovative ways to drive the message, and hopefully over time there will be some more public facing resources. So watch this space.
I'm not sure if this is a new position or not, but I think it's a really important position. And thank you to whoever either created this or maybe you've always had it and I just didn't know about it. But it's a real asset to the whole um, organization to have somebody helping local boards and clients find their place in the community.
I certainly appreciate that, and I should have clarified from the beginning. I apologize. My understanding is that I'm the first person to have this position. I think it's new to the QI team, but I know Corey and Stacy had been really interested in developing this sort of position for quite a while.
Well, congrats on your new job.
Thank you so much.
Thank you so much, Nate, and thank you for all the questions, folks. So I'm going to move right along because we have our director on with us, and I just wanted to give a few family updates from our department. So I'm the Family Outreach and Education Coordinator, and feel free to reach out to me if you have questions or need resources. If I don't have the answers, I have access to a wonderful team of folks who do have the answers and are subject matter experts. So thank you guys. So the department has a great interest in learning about the experiences of caregivers, and we do have a survey out, and we would like to share that. I will share the link in our resources that I send out later. That is available on our website. And I've gotten a lot of questions about how do we get this information? How do I stay up to date on what's happening at the department and the rule changes? And there's a lot of ways that information is shared. We have lots of newsletters. We have the Family Connection newsletter that goes out once a month. We also have Memo Monday, which goes out every Monday with lots of updates and many other newsletters. So we encourage you to sign up for that. We also have a Facebook family forum. There's a lot of information shared not only by me, but other family serving organizations. So there's a lot of information that you can get there as well. So feel free to reach out. This is specifically for families. So families do have their information protected. So thank you. Next, I'm going to hand it over to our DoD leadership. As I mentioned before, we do have an opportunity to talk with our director, Director Hauk. The intent of this time is to hear concerns and give the director an opportunity to collaborate with families. If you have a specific concern or a specific issue, please email me and I can get you connected to the director. and the appropriate parties. So with that, thank you so much, Director Hauk, for joining us.
Hi, everyone. Thanks for having me. I caught the end of the updates, so it sounds like you got a lot of good information this afternoon. And I appreciate the opportunity to be here and hear about how things are going. So I don't know if anyone has specific questions or additional topics that they want to talk about.
I just want to hop in. This is Kate from Northwest Ohio and say thanks for being the voice. Thanks for going to the subcommittee meetings and the budget meetings and everything that you're doing, because it at times at the top it might not seem, that those that are end users and families are super supportive and really appreciative. But I really want to say thank you, thank you, thank you, because you're advocating for things that directly, impact our lives and impact our families and impact our kids and young adults and adults. And if we don't have somebody that cares at the top, then the whole system kind of collapses. And so I just wanted to stop and say thanks.
Thank you so much, Kate. That means a lot to me. We sometimes, it's hard to think about doing some of this work, and but it absolutely matters to all of us, right? So thank you for that.
Director, we do have a question in the chat. Can you please speak about the governor's new Department of Children and Youth and how that will affect early intervention in particular?
Sure. So the governor has proposed in his budget. So, with everything that's proposed right now, we certainly are not sure if that will happen yet. The General Assembly certainly will talk about it. But they have proposed to start a new cabinet level agency that will support all of Ohioans, especially those from prenatal to their 8th birthday, but then also into older agencies for specific units, I guess, or programs, I guess. Things like adoption, foster care, children's services, that sort of thing, obviously goes to age 18 or 21, and things like childcare goes to age 13. So there isn't a hard end, birth date, but they are focusing more on the prenatal to age 8 space. The timeline is not set in stone yet, but I think the hope is that the new agency would stand up in July of this year with a few smaller programs like the Fatherhood Commission, Family and Children First, some of those sorts of things. And then they would slowly, over the next 18 months, transition other programs to the agency. And early intervention is certainly one of the programs that the plan is to transition. So, I will be the first to say, I came to the department to transition early intervention here to our agency. So that hasn't been that long ago, and early intervention is certainly near and dear to my heart. So, it's hard to have some of these conversations sometimes, but when you think about an agency and everybody in that agency solely focusing on children and what's best for children and their families, it's a pretty exciting time. All the resources, all the policies, everything will be dedicated to focusing on families in Ohio. And I think it'll be a good opportunity for us to have conversations with special ed preschool or regular preschool, and some of those opportunities that for kids that might not exist right now, childcare for kids with special needs. I think some of that will be really exciting.
Thank you.
Of course.
And thank you, Corey, for dropping that link in the chat. I can include that as well in our follow-up email. But there's a lot of great information on that website as well about the timeline and the initiatives in that space.
Is that the Bold Beginning website, Corey? Great. Yeah.
Yes.
And they're going to keep that updated as timelines become more firm.
We have a little time left. Does anybody else have any other questions or anything they want to bring up? Okay, yeah, we have a few more questions. So are speech applications covered in the IO waiver?
Is Stacy still on? I don't know, Stacy, if you know the answer to that question.
I'm happy to help. I'm still here. Hi, everyone.
Yeah.
And so I'm absolutely, there is multiple different things that we can support you on, Pamela, in regards to speech applications. I know that there is an ability to get some applications covered outside of the waiver, but also we do have assistive technology service. And so I don't know if Meredith, I can get Pamela's information and we can reach out and get some specifics because we do have assistive tech that covers some options, but we can walk you through, Pamela.
And then the other question about, is there a way for families to give input into the Bold Beginnings process? Absolutely. If you'd like, you can send me any input that you have, or you can send it directly to the governor's office, and I can make sure that Meredith gets that email address.
Thank you. Thank you, Stacy, for dropping your email in the chat as well. And I'll be happy to share that with folks.
Hi, I'm Camille. I am jumping on just for a moment. I'm the one who asked those last few questions about the Bold Beginnings. I am the parent of 3 kids with disabilities, and I'm also involved in a parent-to-parent support organization in Ohio. And I'm just really concerned about how this process has sort of been kind of rolled out. And so I just want to encourage, I feel like I'm asking a lot of people questions about it and there's not a lot of information. So I just want to, as a parent, encourage other parents that if this is the first time that you've learned about this, or if you have concerns about how this process and this changeover especially is going to affect families, that you also spend the time to write an email and voice your concerns. Thank you.
Absolutely. Please feel free to send anything you'd like to our office, and we will be sure to get that to the appropriate people. And I will say, there isn't a ton of information out there yet. As it goes through the budget process, more and more will become available.
Thank you so much. Is there any other questions or thoughts that you'd like to share? I see Harris Caps has his hand raised. Go ahead. Harris, if you have a question. Okay, you can always drop a question in the chat. Amy Davis, go ahead.
Yeah, I just have a quick question. I noticed, I
Hello?
just watched, oh, go ahead.
Can you hear me?
Yes, we can
Yes,
hear
I'm
you.
sorry. Yes.
I'm sorry, I was muted.
No, you're,
I couldn't figure out, I'm not used to the Teams program.
yeah.
The Family Advisory Council, just a general question. Is there a member on the council that has a relative in an intermediate care facility?
I just want to ask a clarifying question. So are you asking about this forum in particular, or are you asking of leadership if we have experience with the ICF or somebody who has a loved one in an ICF?
I'm sorry, what I'm asking is, are there any members of the Family Advisory Council who have a relative in an ICF?
So we have a core group that does advise, and I'm gonna look to Corey because I'm fairly new to the role and with the folks. Corey, are you aware?
Hi, Harris. So we have a Family Advisory Council, a core group. So this Family Advisory Council itself isn't necessarily made up of any particular people or any advisory board. It's a forum for families to come together and to share and to engage and to learn what's happening within the department, but also an opportunity for families to ask questions as we're doing here. There is a core group of approximately 9 people that are family members of loved ones who have individual intellectual and developmental disabilities, and we meet with them quarterly as well. They have gone through a process where they were selected by previous family members within that core group. And to answer your question, I'm not particularly aware if there is anybody who has a loved one in an ICF within that particular family advisory council core group.
Okay,
And that core group is that core group is primarily used as a platform for us to connect with family members, and they advise us on this particular meeting what they think we need to cover, what issues are that they want to hear, they think people want to hear about. So we use them as a way for structuring our time together here to make sure we're
Okay.
covering topics and interests that families have.
Okay, I've taken down Beth Chambers' email address, so maybe I could do this offline. Thank you
Okay.
for clarifying part of that.
Certainly welcome.
Certainly reach out to me. I'll help you with whatever I can.
Amy, did you have a question?
Yeah, I was asking just in general, because I have a lot of family members ask me and I really don't know how to answer it. I just watched, I was just I did a Zoom with I can't remember, I can't find it. I have so many emails, but just like last week about I think it was in Arizona and a couple other states, because there's such a nursing shortage for a lot of the adults, and some adults you'll see like on Facebook page looking for providers because they can't leave the and a nursing home, or they can't go back home until they have nursing in place. And I think Arizona and them, they run some type of program where basically the parents or a family member or neighbor or somebody is being trained, almost like a nursing aide. So they're able to have this person come home and do their more intent, like trachs and stuff like that. I know that we have in Stark, we have med delegation classes, which as a parent, you don't have to take, but I do take them because it's good information and it's free right now. So, but my question is what's happening with that part of the shortage and stuff, like with the nursing staff? Because I know there's a shortage like worldwide everywhere, but with that, have you guys ever heard of any type of programs that some of these states, other communities or states are running?
Hi, Amy. I mean, I know that we are having the same sort of challenges across the board, right? With nursing, DSPs, everyone. And I think what you mentioned with delegation, there are a couple different levels of delegation, nursing delegation. And so that's one way. We also are looking at the rates that pay nurses through Medicaid and some of that sort of thing as well.
Yeah, these actually pay the parents. Like, I think the parents
Okay.
or family member that they trust to give them a break, um, and stuff like that. But like it just, I think every state, I can't remember if I can find what I saw. It was, I think it was a nurse from DD that sent it to me and thought I'd be interested. And it was about advocacy for like the crisis and stuff. And these were, people that talked from like Arizona and some other places of some things that they put in place that they're working
Okay.
on because of such a shortage and stuff. Is there somebody I can send it to?
Yeah, if you want to send that to Meredith or Corey, they'll make sure that it gets to our Medicaid division and we'll
Okay.
certainly take a look at that.
Yeah, because I think they sent, I don't know if I'm still waiting for the PowerPoint and I'm not sure if somebody was from this department either that was on it. I don't think so because I didn't recognize anybody, but like I said, this is the first time I've got on something like this. I found this was just sent, I found this on your guys' website, so I thought it would be interesting. So,
Yeah, that would be, we certainly connect with states all the time around different issues and somebody, from Stacy's team or Medicaid would be happy to look into that.
okay. Thank
Thank
you.
you. Thanks for bringing it up.
You're welcome.
Thank you, Amy. Yeah, definitely interested. We're always innovating and looking at new opportunities, um, and seeing what works in other places as well. Um, I wanted to just, reiterate that this opportunity, this Family Advisory Council meeting is open to anybody who has an interest in the DD system and who is served by our system. So they have an opportunity to learn, to get updates, and have this time with Director Hauk. And we encourage folks to join us. It is quarterly and it's always full of lots of great information. So, um, does anybody else have any other questions or comments that they wanted to share this time?
I'll just say thanks to all of you. Thanks for sharing your time with me today.
Thank you so much, Director. We appreciate you taking time out of your schedule to meet with us as well and share these updates and information. Um, so with that, I will just share. Here is my contact information. I will be sharing all of these great things that everybody has shared with us, all of these updates. Our next Family Advisory Council meeting is June 15th. So stay tuned for that. And as always, feel free to reach out to us. Thank you so much for sharing your afternoon with us. Have a good day.